Good evening. Because this is a very important session, so we wait for a few minutes before everyone joins and then we proceed with our today's topic. We'll wait for just 2 more minutes and then we start. So by the time everyone joins, let's start talking something about the subject. So welcome to this session. I'm Dr. Bankim Jani and I'm over here in association with Vishwa Medical Admission Point. And today we'll be talking something about those competitive exams and we'll be clearing the doubts. Are these exams so difficult or are these exams so easy? What is the importance of these exams? What exactly is the medical scenario, right? So we'll be making ourselves completely clean. In that perspective, that is not a single doubt should be left out by the end of today's session. Now, in case if you have got any of the query, there is a number, right? That is for the personal counseling WhatsApp number that is mentioned. So you can always send a message and you can talk to that number, talk with that number. Okay, so here it is. I'm Dr. Bankim Jani and I'll briefly introduce myself, right? I did my MBBS and then post-graduation in radiology, right? My dissertation was MRI in lumbar intervertebral disc, lumbar disc. Now, perhaps you must be thinking that why I'm writing. This would be our style whenever we'll be discussing any of the topic. The reason behind it is that instead of going for straight away the PowerPoint presentation, here we'll be writing everything. That would be exactly the method when we'll be teaching you any of the medical topics, right? So that's first. I did my MBBS, then DMRE, MD radiology, and with the dissertation in MRI in lumbar intervertebral disc. Then I also went into the field of IT, that is information technology, and got 23 degrees in the IT, in the field of say Cisco, Microsoft, Sun Microsystems, Novell, right? These are the international companies whose accreditations they are there, right? Apart from that, I'm into photography, painting, something which you can watch even on my channel also, right? On top of it, these are some of my medals. I'm into say sports and these are the medals. Well, they are divided into two parts. because last year I suffered from COVID, right? So these are like pre-COVID, pre-COVID medals, and these are the post-COVID medals. All these medals, they are for marathons, ultra marathons, and trail marathons, right? Some long distance running. So you know that in a marathon you are supposed to run 42 kilometers. Why I'm mentioning it over here is because medical is also like a marathon, right? It is not a sprint. It is not so that one has to run very fast for a short distance. No, it is like a marathon, long distance running. So that with that concept, let's start with our today's discussion. Every Wednesday, right? Every Wednesday and every Saturday we shall meet, right? For next few months we shall be meeting every Wednesday and Saturday at 8 p.m. This would be purely for the competitive exams, competitive medical exams. So that is the national exit exam or the national exit test, USMLE, United States Medical Licensing Examination. These will be our prime focus. Also, we'll be talking about PLAB, we'll be talking about some of the exams, that is MCCE, that is for the Canada, right? All these exams we'll be talking about. So today our main focus will be on this national exit exam, NExT, right? And Saturday we'll be talking about USMLE and PLAB. For any of the queries, you can always send a message or you can talk to the number which has been mentioned just over here, right? That's a number. On that you can always contact. Okay, so let's proceed with the scenario. What exactly is the medical scenario? I would like to divide this thing into two parts. So one, that once the person becomes MBBS, till this point, what was the thing? There are two parts. One, person does medical from Indian Medical College, right? That is, he does it from India, or he does the MBBS from abroad, that is outside India. Till this point, it was like all the medical colleges or the universities, they were conducting the final year examination and the person becomes MBBS. He becomes doctor. He can practice, right? He can practice. He has to do the internship, but yes, he'll be able to practice in India. What about abroad? Abroad, the situation was that those universities, they'll be taking the exam. Once these students, they return back to India, they were supposed to appear for the exam, which is called as the Foreign Medical Graduate Examination, FMGE, right? Once this exam is cleared, then and then the person who has done MBBS from abroad, he can really practice, right? So this is like an extra exam. What about the post graduation? Whether the person has done MBBS from India or he has done the MBBS from abroad, they have to appear for what's called as the NEET PG, right? NEET PG, and then the post graduation would start, PG. Whether it is MBBS or whether it is whether it is MD or MS in any of the field, right? So that was the scenario. But now things have changed. Now the things are, whether the person has done MBBS from India or he has done MBBS from abroad, it really doesn't matter. Both of them, after completion of their final MBBS, right, the exam would be in which they have to appear. It is what is called as the National Exit Test, NExT. I'll be telling you in detail about what exactly this exam is, but this is the situation. This is the present scenario. This is the present scenario. I'm stressing more on this is because so much of confusion is there into the field, into the market, right? People say that no, this exam is very tough, or this is the exam. Boss, this exam has not yet come. Now it is starting. So anyone commenting about this exam, right? That is not correct. This exam is something which everyone has to face, whether the person has done MBBS from India or he has done MBBS from abroad. It won't really matter. Everyone has to appear for this exam. Now take it in a very positive way. The thing is, say, till this point, this was the extra exam, right? This was the extra exam which everyone was giving if you are doing MBBS from abroad. But now things have changed, right? It is straight away one exam, one and only one exam, whether you are doing MBBS from India or abroad. So this gives you one big advantage. And that advantage is, once this exam is cleared, this exam will permit to practice, to do the medical practice in India. At the same time, this exam will be useful for the postgraduate admission, post-graduation admission. And this is true for every student, whether India or MBBS, right? So the thing is, in case if you have received less marks into your NEET UG, right, in the NEET, and you are thinking of going abroad for the MBBS, that's not end of the world, right? It is not so that, okay, in India, if someone has not got the admission and then bas khatam. No, this is like a second chance, because whether you are doing it from India or abroad, once again, after completion of final MBBS, everyone will be again on the same platform. Everyone will be onto the same competition. And this is where you can do excel, you can do better, and you can get admission, right, for the post graduation. So the idea is, previously when two exams were to be given, so then there was more effort, right, more money involved, more time involved, because one has to go for that foreign medical graduate examination and then that NEET PG. Both the things, they have been removed, right? Now straight away it is the national exit exam. So importance of this exam is very high. Clear? Right? Because it happens like, say, think of a student, right? He has appeared for NEET. He gets less marks. So then what happens? Right? Person would be sad. Options will be given that don't worry about 1 year, you repeat this. Right? Now, regarding this repeat, I would say that yes, you can go for that repeat NEET only if you feel that either you were sick, or there was some accident, or there were some circumstances in which you were unable to appear for the exam with your full potential. So that's okay in such cases. But if you feel that yes, you have given your heart and soul in appearing for this exam, and whatever the score you have received, so then why to waste one more year? Instead, go for the admission, right? Start your journey of medical, right? Because whether it is India or it is abroad, right? I'm coming to that point that sometimes it is said that what about the quality of education? I'm coming to that, right? But my point is, say, why to waste time? Why to waste time, right? Time is precious. So in any case, you will be facing the medical journey, right? You'll be facing the medical subjects, you'll be learning everything. So why to waste time? Start that, right? Face it. And sooner you start, earlier you'll be completing your MBBS, right? Because after completion of MBBS, yes, now you are on track, that you know that you have to appear for that NExT exam, right? If you want to practice in India. What about if you want to go to US? Well, in that case, USMLE, right? You have to appear for USMLE. That exam, something, it is what we'll be discussing next time, right? planning is important due to the fact that when you plan properly, you work more efficiently. With Vishwa Medical Admission Point, our main idea is that before you start your journey, your entire path should be crystal clear. You should know that, okay, after say 1 year, this is what I'll be facing. After 2 years, this is what I'll be facing. After completion of MBBS, this is what is to be done, right? When the path is clear, ratio of success becomes very high. So this is what is in our mind. That's why this entire session, these sessions, they are planned, right? So that you can plan properly. So here it is. One thing is crystal clear, that whether you do your MBBS from India or abroad, national exit test or the exam is compulsory for everyone. So this is like, it is, if you study properly, straight away you are in competition with any person who is doing MBBS in India, right? Okay. So this was my clarification to you, that say, if you really feel that no, you worked really hard and the score which you have received, it is pretty good, to then go for the MBBS. Don't wait ki chalo let's spend 1 more year, because I do receive emails in which sometimes students say they have wasted 3 years, 3 years in going for that NEET. 1 year marks was not good. They tried second year, again the marks were not good. Tried third year, again it was not good, and then out of sheer frustration, then they take the admission. But then think about the pain which they have suffered for those 3 years. Now they'll be 3 years behind as compared to their friends, right? So in case if the marks are less, that's not end of the world. You start your journey. In any case, you will be coming up in competition with those who are doing MBBS in India, right? So be very clear about these points. Next, when it is said that what about the education quality? Well, definitely it makes a big difference, no doubt, right? Say I studied from BJ Medical College, right? Absolutely superb. And when you study abroad, well, you are away from the home, right? You are away from the home, and the temperatures difference would be there, right? Because those areas, they are pretty cold, and you might feel that there would be a language problem. But I always say, friends, some things are to be experienced, right? Everything is like an experience. What we should be really focused on, that I want to finish my MBBS in its best possible way. Over here, yes, there is definitely self-study. It is not so that there is like spoon feeding in many of the subjects, because I won't be commenting on any particular subject, but yes, it invariably happens that some of the subjects, say I won't be insulting any teacher, but it happens like there is a sort of self-study in some of the subjects. Here also there would be some things like self-study, and that's why we are with you, right? That's why we are with you. That during this entire journey, it's not so that you, once you have taken the admission and bye bye. No, it's not like that, right? We'll be with you at every step. Say last year only, we conducted so many training sessions on the subject of anatomy, and in that, literally every piece, every layer was dissected of human body, right? And then it was explained very properly. So if you really see those training sessions, you will find that that a definite effort has been made so that you understand the subject very properly. Once you have understood the subject properly, it becomes much easier, because say this is the base. Our effort will always be there to create a strong base for you guys, right? And then as you proceed, it becomes much easier, because this is like a foundation. Once the foundation is good, right, the basic subjects, anatomy, physiology, they are good, so then obviously anatomy, it is good, so then in future your surgery would be very fine, because you know the contents. Anatomy means the structure of the body, right, something which you dissect and then you see. So all those muscles, nerves, arteries, veins, right, everything, once you see, you understand, and then it becomes much easier, because this anatomy, where the dissection is on a dead body, right? While in case of surgery, you are dealing with a live body, but contents, so they remain same, right? So it is like that's where the understanding matters, how you understand the subject. Remember, in medical, I always say you just can't cram. That ratification, that is some of the worst thing, right? You will never do that. Now, whether you are doing it from India or abroad, it really doesn't matter, right? You go to these videos, go to my channel, you'll find that in association with VMAP, right? In short, I'll call VMAP, right? Vishwa Medical Admission Point. So now onwards, I'll be using VMAP, right? Lovingly, we call it VMAP. Okay, so with VMAP we conducted so many sessions. Means, I mean, there are hundreds of sessions, right? And each session where every part is dissected and explained. So you'll find, say, upper limb, lower limb, abdomen, pelvis, brain, skull, right? There are lectures on cardiology, right? So many, right? So many. You'll just, you can have a look at that. But idea is this: a strong base, and then as you progress. So in future, yes, you'll be coming across so many other sessions also. So what does that prove? That proves two things. One, start your MBBS journey as fast, as early as possible without wasting time. Second, again, not insulting any of the field, but say, due respect, whether it is Ayurveda or it is homeopathy, right? All these options, they are at times given by many people. But trust me, I heard few of the students, and I received their mail also, when they say that, sir, after doing this Ayurvedic or homeopath, we want to become a radiologist, right? Now see, this is absolute cheating. This is not possible. This is not possible. You can do MBBS, you can do radiology after doing your MBBS, not by any of these others, right? Ayurveda or homeopath. No, that is not possible. That is not possible. It's a wrong thing. It's a wrong message which if someone is telling you about it. So be very clear about this. Definitely, see, you are here, right? You appear, you take admission in any of the country, right? You complete your MBBS, you come back, you appear for the national exit exam, a national exit test, right? You do your internship. After doing your internship, you go for PG. In this PG, if you want to go for MD radiology, right, you are most welcome. Definitely you can do it, right? Well, you are doing MBBS from India, then also path remains the same, right? You have done your MBBS and then entire path is same. So whether it is abroad or it is India, it is one and the same thing. But if someone is doing, say, bachelor in Ayurvedic medicine, right, or homeopathy, are they allowed to go on this path? No, no. For national exit exam, it's made very clear that it is for MBBS. It is not for any of the other fields, right? So don't go for any of such unless and until you have got specific interest in Ayurveda or homeopath. You are always welcome, right? You can definitely go, but be very clear. that these paths, right, regarding this radiology, or you want to go into orthopedic, or you want to go for neurology, or you want to become a cardiologist, or you want to do USMLE, you want to go to US, right, or you want to go to Canada, or you want to go to UK. All those exams, they require this basic MBBS, right? So next time when we'll be talking about USMLE, or we'll be talking about this PLAB, all those things, MBBS is must. None of these, like Ayurveda or homeopathy, they are allowed, right? It's a big cross. Next, one more thing. So many, because say I was say very clear about some of the concepts before even starting this course. I get lots and lots of emails where the options are given by many of the educational counselor. Go for biotechnology, right? Go for biotechnology, or many of the such alternative sciences. And then they say that you'll be called as the scientist, right? You'll be called as scientist, and once you are scientist, so you'll be getting the pay scale, and what they offer is, that was amazing, that is, you'll be getting pay scale in the range of crores. Really, this is pathetic. This is pathetic, right? Nope. No one gets that pay scale, right? Open your eyes, look into the market. Really, it is, I'll tell you exactly, like, you know, people say that do MBA, right? Those who are into commerce, they say do MBA, right? After MBA, you'll get this degree and that degree, and you'll be getting such high, say, pay scales. So many MBAs, again, not insulting any of the MBAs, right? But so many MBAs, they know in their heart that what they are doing, right? Seriously, if it is from, say, IIM or Symbiosis or any of those high quality education institutes, then it is fine. But otherwise, yes, I have seen so many MBAs doing the job at such a low pay scale. So weren't they serious? Weren't they clear about what they are learning? Yes, they were knowing, but the guidance was wrong. Right? If someone is doing it from IIM Ahmedabad, so I would say, yes, go ahead. You don't have to worry. But if it is from some other small institutes, yes, you know that what they do. Right? So guys, open your eyes. Know that what is happening into the market. So many false commitments are given. So many dreams they are shown, that this is what would happen, right? And then after wasting those golden years of your life, right, golden years of your life, what really happens is, it is the struggle which keeps on going on and on. You must have noticed that doctors, once you become MBBS, right, whether it is from India or it is abroad, still the level of respect, and I would be very clear, the money you earn. Yeah, definitely. In even in US right now, if you see, doctors, they earn maximum, right? Is money everything? Well, I won't say money is everything, but lack of money is something. It looks good only in poems, right? It looks good in the romantic movies, that no, money is nothing, this, that, everything. But in reality, well, it is needed, right? Life should be good, right? Life should be good. So that's the reason I use this statement, that those, in the initial stages of your life, that is these years, right, these early years, आप कुछ काम करते हैं, तो it is called as the मेहनत, right? It is called as the efforts. It is called as the efforts. And if someone has wasted these years, ये साल बिगाड़ दिए, तो then rest of the life जो मेहनत करनी पड़ती, it is not मेहनत, it is मजदूरी, it is the struggle, it is the struggle. So I always insist on that gentlemen, these are the years where your efforts, where your energy level, everything is so high, so give it, right? Don't listen to anyone that अरे मेडिकल में तो बहुत पढ़ना पड़ता है. Definitely yes, but then the rewards are so high. अगर जो इतना ही easy होता तो सभी कर लेते. So be very clear in that. Is it like frustrating? हाँ, definitely. I'm telling you from my experience. At times कितना पढ़ते फिर भी कहते यार भूल गए. Happens. It's normal because अगर जो कुछ भूल जाते हैं, when we forget anything, तो that itself indicates कि we have got a normal human brain, right? Only computers they don't forget, right? Only robots they don't forget because it is programmed. We are humans, but then there are very scientific methods, something like say super reading, right? Super reading. Last year we conducted even this session also, not one, but there were multiple sessions on super reading. Super reading is that method which really helps every student so much, because once practiced very properly, yes, you will be able to remember, you will be able to understand the subject in much better way. So your entire medical journey will become very easy. Yes, last year we conducted in association with VMAP even these sessions, so that the journey becomes smooth, right? So it is like a war. Yeah, it is like a war, right? You are into the war, but we prepare you so properly so that you always come as a winner, right? That's the whole idea. The number which has been displayed, that is this 93565 57352. This is for personal counseling, right? So you can just WhatsApp on that number and you can be in touch. In case if you got any of the queries, right, I'll be going into the detail of now national exit test, but say in case if you got any query, you can always say be in touch with this number, right? That is for personal counseling. Okay. Now here it is. I'm adding more pages one by one, right? So that I can write. Yes, even in during our all topics, all subjects, we'll be learning exactly like that. So actually we'll be learning like, say, when we say this, that this is ECG, so this is P, Q, R, S, T, right? These are the waves, and then we'll explain that what will happen when this wave comes. So everything will be written. There'll be lots and lots of images also which you will see. But the whole idea is that as we write, right, it makes our understanding more and much better and better. Not like just showing only the PowerPoint slides. No, that is not in our blood. We never do that, right? Even in histology also. Histology is like those slides, right? Those slides when you watch. So even in those slides, we show you the slides, but then we'll be drawing, we'll be telling that, okay, say this is where the nucleus is. These are the types of cells, right? And then we'll zoom that and we'll show you. So actually, when you really look into the microscope, you will find that yes, everything makes sense, right? How things are. So that's the whole idea behind it is. Moving on to our all these competitive exams, right? I'll collectively call it as competitive exams. So what these competitive exams, why they are there? Well, in India also, there are so many medical colleges, right? Abroad, so many medical colleges. So then there has to be a common exam which will evaluate everyone whether the person has passed from India or abroad. Correct? Now you want to practice where? You decide. Right? Let's be very clear. If someone tells, no, I don't want to practice in India, I want to practice in US. Fine. Then Gentlemen, you don't have to appear for this national exit test. It is not for you. You want to practice in USA. So then for you, the exam is USMLE, right? In which there are step 1, step 2, step 3, what we'll be discussing next time, right? And yes, after your second MBBS, if you are preparing properly, you can start appearing for the step 1, right? I'll show you the complete path next time when we'll be discussing this USMLE. But this is how it is true for everyone. What about if you want to practice in India and you want to go for the post graduation, right? So then national exit exam, I would write in capitals, it is mandatory. It is compulsory for everyone. It is compulsory for everyone. It is starting from this year, right? It is starting from this year. Otherwise, previously, as I told you, it was foreign medical graduate examination, that is for those who have passed from abroad. And then everyone, that is India or abroad, they have to appear for that NEET PG. And then basis of that NEET PG, the post graduation was granted. Correct? Now it is this national exit exam. Now, what type of exam this is? Now, this is an exam which will actually test your knowledge, right? Which will actually test your knowledge. Gone are the days when person used to score just by cramming, right? We'll be going into the details, but when I say it is your understanding, it is your understanding which is important. Your ability to diagnose, is more important. Can you really diagnose the condition? Can you really treat it properly? When this thing comes, when understanding or diagnosis comes, I tell you that knowledge is not anyone's property, right? Right from your first MBBS, at times, if I say something, people feel that yes, it is very harsh, but yes, I say that. Don't listen to anyone if anyone tells that boss abhi mat padho, right? Final MBBS mein ek saath pad lenge. No, never ever do that. Those who are consistent, right? In that story of that is rabbit and tortoise, right? Kachua or rabbit, right? इसकी जो story है. Over here in medical, it is this tortoise wins. Consistent, slow and steady wins the race. Yes, every day you study, you understand the subject, and then gradually you will be able to digest that subject. So that's why this is very vital. Right from the first MBBS, yes, you have to study, because keep in your mind, you are appearing for this NExT national exit test, and this national exit test is like sister of USMLE, right? They both are based on the same concept of understanding and not cramming, right? There would be very less question where you have to just your crammed knowledge would be important. No, you have to really diagnose it. Okay? So never fall in that trap if someone tells कि बाद में पढ़ लेंगे. No, it has to be immediate. This is the major difference between, say, if India and abroad. Say you are smart people, right? In India, if you are studying, so yes, parents are there with you. When you go abroad, right, it's an entire world. It's a very like a fairy tale. But discipline, right? Discipline. Your life is more important and not any of the other things. So never ever sway, drift, right? Go here and there from your target. Study well, because you know that this exam will be there for everyone, right? So no one is loser, right? By giving exam or by appearing in MBBS abroad. Sometimes when people say that अरे बाहर से कर रहे हो, हाँ तो why not, right? There is no harm in doing that. True. Just a minute. Let me add one more page. Okay. Right. So this national exit test, first thing first, there are no restrictions in attempts. No restrictions in attempts. Now I'll be giving you the worst scenario, right? Worst scenario. No one can be as bad as that. Chaliye, you got some less marks in NEET, right? No problems. You took admission abroad. You did the MBBS over there. Fine. You appear for the national exit exam. Okay. Maybe for any of the reason not successful. Doesn't matter. Appear again, second attempt. Because you know that the moment you clear this exam, you will be able to practice, right? In front of your name, that doctor and your name, it has come, right? So here, it is not the roadblock. It is not end of the world. You can appear for this exam again, right? So there is no restriction in attempts. This is first thing, right? This is the first thing. This national exit exam is divided into two parts, right? So there is, it is called as the NExT exam 1 and the exam 2. The first part and the second part. This first part will be focusing on theory. The second part will be focused on practical. When we say practical, that means it will be sort of viva, practical exam, where you have to really show your medical skills. You have to show your clinical skills, right? And this first part, that is the theory part, that is where every subject will be evaluated, right? 50%. 50% is the passing mark. 50% is the pass marks, right? 50%. Now we move on to this interesting fact that this part 1 or the exam 1 of NEET, this is where the score will be given. I'll show you in detail that how many questions and which subjects and what exactly is the pattern, but you'll be getting a score, right? Total of 540 questions are asked, 540 questions total. And out of that, you'll be given, depending upon how many questions you have answered correctly, right? You'll be getting a score, right? This is like an online exam, right? 50% is passing. Once you have passed, its validity is 2 years. Now, what is this validity? Validity means that this exam, which you have cleared, right? After that, you will be allowed to go for internship. And during that, you have to appear for part 2. Part 2. Now, this part 2 is viva, right? This part 2 is viva. But over here, no marks are given. It is just pass or fail. Pass or fail. And once you clear your part 2, you can go for PG. I'll explain this thing once again. Right? This is vital. This is very, very important. Because that would make a complete sense that what exactly are these day 1, day 2, day 3, and how is the schedule, right? So let's make it still more simpler. So here it is that this is National Exit Test 1 right? Part 1. This part 1, which is theory, 50% passing, 50% score is for clearing it, right? 540 questions are asked, and it's once this is done, you go for internship, 1 year internship, right? And in fact, you learn a lot during this internship. The validity of this exam, right? Validity is 2 years. 2 years. 2 years. The score of first part is important for your PG admission. PG admission, which you will be going for after you complete your second exam. But score of first exam will be used for PG admissions. So in case if someone misses the PG admission 1 year, the same score can be tried even for the second year also, right? And then the second part, which is clinical, right? Which is clinical and viva. In this, no score is given. It is just pass or fail. So once you have passed, you are eligible for the post-graduation admission as per the score of part 1. See, part 1 is so important, right? And this is where your clinical skills are evaluated in the second part. So how is everything situated, right? How is the exam? Now, well, this national exit exam, it is a 3-day exam, right? It is a 3-day exam. To make things a bit easier, there are few subjects which are considered as the prime subjects, and then there are other subjects which are called as the allied subject. Allied subjects. So every day as the exam would start, there would be a pre-lunch session and the post-lunch session. In the pre-lunch session, this is a 3-hour exam in which 120 questions would be asked, right? 120 questions. These questions, which will mostly be focusing on medicine, right? Plus dermatology and psychiatry. Right? See how nicely the everything is arranged, right? So 3-hour exam, 120 questions. It means that you have to appear for 40 questions per hour. This calculation is important. It means you'll be getting rough about 1.5 minute per question, right? That is 90 seconds per question. Post-lunch session, pediatrics, right? That would be just 90 minutes, 60 questions. So same calculation, right? So this is like day 1. Day 2, where the surgery would be the prime subject, right? And orthopedics and anesthesia, they will be a lead subject, same way, right? 3 hours, 120 questions. Post lunch, right? ENT, 90 questions, 90 minutes and 60 questions. And similarly, the day 3, so last day, when this is pre-lunch session, there is obstetrics and gynecology plus radio diagnosis, that is radiology, that is as a prime subject, right? And the elite subject, 3 hours, 120 questions. Post lunch, ophthalmology, 90 minutes and 60 questions. So every day, 60 plus 120, that is 180 questions every day, and into 3, because exam is of 3 days. So that's how we get 540 questions exam that is spread across 3 days, right? And you have to score 50%. That's a passing, right? How much time would it take? I'll show you the whole pattern. This is the exam pattern of NExT. See, problem solving, where you have to really solve the case. 60% of the questions, they will be based on the problem solving. 60%, right? This is where, when we said that it is this basic foundation, your understanding, that matters, because 60% of the questions will be problem solving. Comprehensive or analysis, again, 30%, right? This is where you have to do the diagnosis, right? You have to go for specific test, or where you will be solving the questions which are related to a specific disease, right? We have to go for what's called as the differential diagnosis. Differential diagnosis is, that is, what is the most probable diagnosis in a particular given case. And recall is that informative type, informative. So when it is straight away asked that, okay, brachial plexus, right? Which are the nerves which are involved into the brachial plexus? What is the root value? So that is like an informative thing, right? When it is said that, okay, this is the aorta, right? So out of that, right, you'll be pointed out that, okay, what is the name of this particular artery, right? So that's how, say, when you'll be drawing it, like this is right, so this will becomes left common carotid artery. So something which is not requiring any of the analysis, but it is just requiring you to remember the things. So bus, that is 10%. The rest is all your understanding, diagnosis, your foundation, how strong it is, how can you really solve the problem. This makes things much easier, right? Gentlemen, it makes things easier, because the diagnosis, your logic, right? Your logic is what really matters. Your ability to analyze, that is what really matters. So due to this type of exam, right? These are what is called as the competitive exam. No one is interested in the world, in real world, no one is interested in that how many degrees you have. Seriously. Degrees, they can at the most take you to the level of interview, not more than that. In interview, you will be faced with a real tough situation where you will be evaluated, right? You will be evaluated. Let's say you start a company and you will be hiring only that person who can solve your problem. ठीक? If someone comes up with all those certificates, right, you'll say, ah, ठीक है, we respect your certificate, but do you really know the subject? If you really know the subject, then yes, you are the person whom I'll be hiring. Simple. Same thing is over here. So when your logic is good, when your ability to analyze the things, they are good, so then you are good at not local level, right? Not at national level. You are good at international level, right? You are good at every level. So this is what requires the patience. This is what requires the work right from the beginning. And that's why your foundation is important. That's why we are putting all these efforts so that your foundation becomes and remains strong. You got the idea? We are telling this thing. This is in fact the most important concept. And you will agree with that understanding, that problem solving capability, that analytical capability, it comes with some time, right? So that's why it is necessary to start the journey as early as possible, so that you work and understand the things proper. Yeah, right. There are helplines on this number also. Now, what would be, what exactly is like this national exit? When we say this NExT exam, the exam comes in second week of December, right? I'm giving you the whole pattern, right? So one, what is called as the NExT step 1, regular. right? This is, I'm giving you the complete scenario. This is step one or the next first exam, regular. Irregular means it's like you, right, who is appearing for the first time. Exam date, that would be in the second week of December. Result, it takes about 1 month. It takes about 1 month. So result will come somewhere into the second week of January. Okay? Second week of January. Now there would be, after that, there would be a supplementary exam. This is like a supplementary exam. Now, what supplementary exam is? Supplementary exam is that exam that in case, if someone has not passed, right? In case if someone has not passed in any of the above exam, day 1 or day 2. So in January only, right, there would be this supplementary exam, right? And result of that exam would be into the 4th week. So it comes faster, 4th week of January. So idea is that even if one subject is left out, so that thing is cleared. Once it is cleared, your internship starts. This internship will start in February 1st week, right? February 1st week. And then that for the entire first week, right, to all the way to 1 year, you will be appearing for that internship. Once you complete your internship, next year, right, there would be step 2 regular. Step 2 regular. So in step 2 regular, right, that would be, say you'll be completing your internship in February. So in March next year, there would be step 2 regular. And then in case if someone is not successful in that, so then there would be supplementary, right? Step 2 supplementary. Supplementary is like a retest, right? Supplementary means it is like a retest. If someone is not through, so then they can go for this retest, which is in the month of April. So obviously by these efforts, you will be able to go through it. Once it is through, it is the month of May, June, when there would be PG admission, right? There would be PG admission. So which ends by 30th of June. And then post-graduation course, they start with July 1st, right? That is the PG course, wherever you have taken the admission. So see, everything is where you are given so many chances, right? It's not so that just one something which is not cleared and you don't get a second chance. All these chances, they are there. And again, there is no limit. So if someone is miserably, say, weak in any of the subject, no problem. Once again, they can appear for the test. But this is the whole schedule. The idea behind it is that it starts in December, right? Appear for the interviews in the next March after completion of the MBBS, and then go ahead with the PG admission and the PG course, right? These tests, why it was necessary, right? Why was it necessary to go for this test? People say that this test will be very tough, etc. But whatever, it is tough for everyone. It is good for everyone, right? Previously, say, it is like there was a sort of bias. Say if the student has done MBBS from abroad, right, so then he has to appear for foreign medical graduate exam extra. Now that extra exam has been eliminated. Whether it is India, whether it is abroad, for everyone, this is the exam. right? This is the exam. And I showed you step 1, step 2. So this is how things will be proceeding, right? So numbers are there for your personal counseling, and you can definitely approach any of the questions you have. You can surely send those questions on that number and you can talk to them. See you on Saturday, right? See you on Saturday, where we'll be going for still higher level. What if you want to practice abroad? Definitely, what are the scopes? Yes, scopes are very good. And yes, so many students of mine, they are studying abroad, right, into US and Canada after completion of their USMLE and other exams. So what is the scenario, especially in United States? How to appear for this exam, right? What are the rules? Everything we'll be discussing. How to register, what exactly is the cost, right? Because this exam, it is a bit costly. So we'll be discussing even the cost, right? So that you have got a clear roadmap in front of you, that once I take admission, this is my target and this is what will be needed. And in order to make these things still better, every Sunday we are planning for one more session, and that is for the medical guidance. Medical guidance means that if this is especially for parents, that when your child is doing MBBS, then what are your responsibilities? What exactly is needed from your side, right? It should not be that if the son is doing, say, MBBS and father is not knowing even the subjects. No. What is really needed for your success? That's why it has been mentioned that parents will be specially invited, right? So that was for today. Thank you so much. And in case of any queries, right, I've given you the numbers they are mentioned. You can be in touch. Thanks a lot. And we meet once again on Saturday, right? Thank you and take care. See you. Bye bye.